Hello everyone, I am Shanta Borkar, working as a counselor with Yash IVF, Pune. We will be discussing how to check the patency of the blocked fallopian tube. What do you mean by patency? By patency we mean whether the fallopian tube is open at both ends or not. The significance of this being that when the ovum is released from the ovary, it needs to come till the uterus. The fallopian tube is the route by which the egg comes to the uterus. If there is any blockage in this or anything which is avoiding the egg from traveling till the uterus, then the probabilities of having a pregnancy go down. The study of the fallopian tube can be done in three ways. Firstly, what is known as the HSG or the Hysterosalpingography or the Hysteroscopy. Hystero meaning uterus, salpinges mean the fallopian tubes, and graphy means the study of that. In this, we use an X-ray to study the fallopian tubes and to see whether the fallopian tubes are patent or not. In this, a X-ray dye is pushed through the uterus, and then the uterus outline and the fallopian tubes can be visualized. However, the negative part being that this is a very painful procedure. Second, SSG, the Sonohysterography, wherein sono means the use of sound waves to study the salpinges, that is the fallopian tubes. In this, saline is used to study the salpinges. Saline is pushed through the uterus, and then using the sonography machine, we study the flow of the saline through the fallopian tubes. This has an advantage over HSG because number one, this is painless or less painful than HSG. Number two, in this the ovaries also can be visualized. The advantages of this are, number one, this is less painful than HSG or more or less pain free. In this, because we are using saline, the flow can be studied while passing from the uterus through the tubes. Thirdly, we can also see the ovaries along with this while doing the sonosalpingography. The third procedure is what is known as the video hysteroscopy, also sometimes known as VHL. In this, we are using laparoscopy to study the uterus and the fallopian tubes. This has a higher advantage over both the SSG as well as the HSG. The reason being that in this, we can study the tubes both inside as well as outside. The relation between the ovary and the fallopian tubes can be studied. Here we can also see whether the fallopian tubes are having any adhesions anywhere. Also, the uterus can be studied both internally and externally at the same time.